Is good? Okay, all right. I'm doing a quick training on how to do a ostomy. Basically, this patient, let's just pretend this patient has excoriated and macerated areas of the around the ostomy. Okay, for example, I think room 28 has an ostomy, and she's got around the ostomy you have areas that are red and raw, and it's very painful. What's happening with that resident is that either the CNAs or our staff is not changing or emptying the ostomy bag frequently enough, and so it's either bursting, and so we're ripping those dressing off too soon or too often, and it's causing redness, excoriation, and pain basically to that patient. So it's hard to make anything stick if you have a tissue that's red and raw, and there's no more basically top layers of the skin on there. So what we're gonna do is we're gonna try to minimize the pain, but also soak up the moisture so you can create a adherence there. Okay. So the equipment that I have in here is also, I don't have the things that I need, so I'm also just pretending like these are like, this is lidocaine. I'm just making pretend here, but this is also, I'm going to say that there's a stoma paste, because right now I don't have stoma paste. In either case, we're gonna start off with trying to minimize the pain. So what I would do with the lidocaine is I would apply some lidocaine in the area where it's painful, which is this area here was excoriated, right? So that area that's painful, you want to let that lidocaine sit for a couple minutes until the localized pain has been treated. After that, when it's all nice and dry, you can apply some of this stoma powder. What it does is that at the moment, if it's moist and wet, it's hard to make anything stick. And our goal right now, our initial goal was to remove the pain, but right now our secondary goal now is to make things stick on here. So what we need to do is actually apply this powder on top of here, and that'll soak up. This powder, its job is to basically soak up these moistures on there. Okay, so once that area is nice and dry now, because the stoma powder has basically removed some of that moisture out of there, now you have a tissue that's ready to have these things applied on there. Okay, you also have a cleanser that's on there. You can try to clean the area here. Don't use the regular skin prep because that's going to burn. Use the ones that are peristomach cleanser, and it doesn't sting. Okay, it won't sting the patient. So clean around what you have here is pathogens and bacteria. So if you clean that off, you decrease the incidence of infection. That's just basics as far as wound care. You clean that off the area, and that's like the #1 way to prevent pathogens and bacteria of infecting that area. So you'll have this is make pretend this is my stoma right here, and the periwound that's around it. With 28A, she's difficult because she has indentations and crevices all around in there, so it's hard to make anything stick. Okay, so if you have a stoma paste, what you can do is you can apply stoma paste all around that area. Okay, what that does is it covers, if there's a hole or indentation around here that goes down, the stoma paste is going to cover that. So the stoma paste is great for that, to cover this area, so that way now when you're ready to apply your bag on here, there's less holes in there. What happens if you don't put the stoma paste in there, you just put the bag on top of it, bowel movement can leak underneath that. So that's why this paste is really important, to cover those little holes underneath that. If you don't have stoma paste, you also have this right here. Okay, and this is not stoma paste, obviously, this is A&D, but we're ordering more stoma paste. If you don't have stoma paste, you also have this ring here. It works the same, except this is actually a little bit thicker, and this one would work also. It's just I think the stoma paste is a little bit better than this, But if you put the ring around that, it covers, you can see you cover the holes and everything. You push that down. This right here kind of conforms to your body temperature. So you want to push that down, and this will prevent bowel movement and leakage from this area, and you prevent any kind of you know, malfunction from your bag, okay, your application. Then you can put your stoma bag on top of that. But let's go back to the very beginning, because your main focus initially, because this patient now has raw periwounds, right? Pain was the number one thing we wanted to focus on, and the lidocaine was important. Okay, so you let the lidocaine sit and get rid of the localized pain. Your second goal is to make it stick. So moisture is your number one enemy at that point. You're using this powder to remove moisture. Okay, you soak up the moisture. Then after you have a nice area now that's, you know, you're able to make things stick, you're gonna be playing around with areas like this with those little cracks and stuff on there. If you don't address that, like I said, the fluids, the bodily fluids, the bowel movement that's you know, that's in fluid form, it's gonna leak right through that, and it's gonna make these things come off. And then now that's why you have 28A. Her stoma bag is always coming off, because we didn't address the fact that, hey, there's little areas here, indentations and crevices that we're not covering. So either use this or use a stoma paste to cover it. Okay, and then now you can put your stoma bag on top of that. I'm gonna make a better video next time when I have more equipment. But this is just an overview of just the basics on how to apply ostomy in somebody who has a deteriorating periwound around the ostomy. Okay, so like I said, I'll make a better video next time when I have more equipment. But for now, let's try to follow these orders to take care of, I believe it's 27 or 28A.
28A.
28A. Yeah, she gets at that point where the tissue gets pretty damaged, and it's really hard to make things stick. But your main goal at that point is to kind of remove moisture. And I know it's really hard when you're changing the ostomy bag and you have bowel movement that keeps coming out, but you gotta just time it correctly. You know, before a meal, after she drinks, you know, you gotta wait a couple hours maybe. But like I said, a better video will come out soon. This is just kind of an emergency type of video that I wanted to get out there. Okay, thanks guys.